Good afternoon, everybody. Welcome back for the Thursday meeting. My name is Srilekha, and today I will be walking you all through the preparation of your data for analysis. Today's talk is going to be a little bit, will take you back to your basics. We're all really busy. We do a lot of work with a lot of data. We tend to forget our basics when we come to a lot of data analysis. So today, the talk is going to be really simple. It's just simple hacks in Excel or whatever you miss during your entire data analysis work. To start with, this is the first question I'm going to ask the crowd. I just want you all to be a little more interactive. What do you guys think is the number one reason for poor quality or bad data? Can anybody answer? Anyone from the crowd? What could be the sole reason why we have bad? It's a very basic thing. Anybody? Okay, so it's human error. We know that we manually enter the data. We know that we still don't have automated technologies where the data can be just stored into our computers. So there is manual error that is involved. Just to briefly give you an introduction, what is clean data? Data that is easy to understand, it's complete, it's relevant, it helps you analyze better, you make better decisions, you don't have issues when it comes to your analysis software. So what do you mean by bad or dirty data? It's the exact opposite. Something that is irrelevant, something that is incomplete, that uh, is difficult to read, you cannot interpret, you cannot upload that kind of a data into a software because the software immediately rejects that type of a data. You're not able to analyze, poor decision making. All in all, your entire effort on that entire project goes to waste because you did not clean your data. So cleaning the data is really important. What else could be the reason why you have inaccurate data? The first is the poor quality, poor data entry, because we still do not have automated data entry systems. Second is non-standardized practice. When it comes to the clinical side, when you're taking patient data, we do use performers. Sometimes we don't just stick to performers, we directly ask the patient and enter the data into the Excel sheet. There are multiple ways where we take data from a patient. So there are reasons where we can have, we are humans after all. So we do tend to miss some data. We tend to miss some amount of stuff here and there. So we need to have a standardized protocol when it comes to understanding or analyzing the data. So the second thing is not having a standardized for data. Third, when it comes to patients, follow-up is the biggest problem. You miss on data. You don't follow up. Patients go out. They don't come out for months. They go and get their tests done outside. We don't have a lot of data of their recent labs. We don't have data about where they've been or how their status was in the past couple of months. So a lot of data is missing. So this is one of the biggest problems of a bad data. Duplicates. When we're trying to make combined Excel sheets, I know I've also faced this problem where I'm combining two Excel sheets and I have an issue where I'm trying to copy it from here and paste it there. So we have problems in copy pasting. This leads to a lot of duplicates. Now, if you're doing multi-centric data studies, you have data that come in from other sources. So duplicates are a big problem. And the last is outdated or inefficient systems. Last week, I think during the Tuesday meeting, Mithun sir was talking about RedCap, if you guys remember. So that is one of the systems where you can add all your data, the patient data. So we also in the hospital have a couple of systems where all of the patient data, including the labs, their current demographic data, whatever data that has been collected has been stored in one place. So if that system is not updated, it leads to poor data. What types of data do we have in our setup? A research-based facility that is attached to a hospital. We have internal data as well as external. In our internal data, it is not just the data that we get from the hospital side when we're taking patients or controls. It's also the data that we do in the lab, the tests that we run in the lab, the data that we upload along with the other clinical data. It's important that it matches. We have inconsistency there because someone else is doing the clinical side and we're at the basic research end. So we do have gaps over there where we need to have a system that we can integrate both the data sets, and that helps a lot for the project. Again, when we're doing multicentric studies, we have data that comes from the outside. We have a lot of issues with that because multicentric data studies, again, you will have, suppose a patient comes here today and he doesn't belong to this particular state, and you've taken the data from this particular patient, but you have no idea that this patient was already enrolled in the study from another center. You will have duplicate data because of, you'll have certain data that are missing. So it's really important to understand the type of data that comes in. So I really want the audience to be a little bit more interactive. This is a demo data set. Can you spot the problems that are there in this data? Just a rough idea. We just start naming any problems over here. Thanks. What else is missing? Anything else? Blood group. Yeah, blood group is missing. Age, yes, age is missing. UHIDs are mixed. Yes, correct. Yes and no are not uniform. So that's correct. So these are some inaccuracies that happen. Now this can happen when we are manually entering the data from a patient. So we're talking to the patient, we have our laptop on the side, we're writing, we're asking them questions, we just casually just keep typing, okay, yeah, we know, next, and we keep typing. So the spelling inaccuracies, inaccurate date format, all of those lead to bad data. Now, if you try to put this Excel directly into a software trying to do statistics, it will not take it in because your data is not, it's not proper, it's not clean. Also, you must have missed, there is a duplicate down there. That entire data is duplicate, copy pasting. There's so many errors in just this one data sheet. So we're going to talk about these kinds of errors, and then I'll show you a demo later on some tips and tricks to reduce this kind of data error. The first was spelling errors. As you said, the yes and no was not consistent. The yes and no's were not consistent. You had name errors. If you could see the names, the spellings were off the charts. You had various capitals and smalls throughout data. Next was incorrect number formatting. In the date, you could see numbers, you could see percentage. You need to make sure that whatever data you're adding should be in the right. Then blanks and nulls. This is a huge problem. Blanks are very different from nulls. Blanks are data that are missing, but you know that you can get this data from a particular patient, or you can go back to the performers, or you can go and look at the data. You can go and look back. You can have the data. But nulls are NA, not available. Suppose a patient has gone and he has gone his tests and gotten somewhere else, and he doesn't have those reports anymore. You do not have access to that kind of a data. So that's a not available or a null data. Whether you want to include that in your analysis, whether you want to include that patient or that entire data set in your analysis is really important. You need to differentiate between those types of data. Next is duplicates, incorrect labels, or the field length consistencies. Now in softwares like SPSS, if you have blank spaces between your labels also of the columns, it will not take it in because it doesn't accept blanks. You need to use underscore for your column labels also. It's really important that depending on what you're going to use for your analysis, you need to modify your data set. So what we do is screening, like how I just asked you all, what are the problems? That is the part of screening. You screen your entire data set. You try to remove all of the unwanted data like the nulls, whether you want them or not. You fix your grammatical errors. You take care that during merging the data that you don't have redundancies or duplicates. You try to sort them. You try to put them into tables. When you put them into tables and you use conditional formatting, you try to find out the blanks in the data set. You try to find out if there are any duplicates. You use data validation for certain columns so that even if you're typing, there is no error because that particular column will not allow you any other option except for what you have used during your data validation. You use pivot tables again to understand whether data is good or not. Visualizing data. Now, visualizing data also helps understand whether your data set is clean or not. As you saw, there were inconsistencies in the diabetic status, yes and no. Suppose I was supposed to create a pie chart or a pi diagram for a diagram for it. It will show me 4 instead of 2. Instead of just yes and no, it will show me inconsistent triple yeses and more no's. So using that visualization also, I can understand that, okay, my data is not clean. I need to make the spelling consistent. So after performing all of that, my data is fine. The analysis. We're going to use an Excel sheet just to show a few tricks of how to do it. Now we know that we manually enter the data most of the time, but what if the data is in a CSV format or we need to insert the data from somewhere else? There is a small trick for that. When you go into your data sheet and you say get data, CSV, you look at this, get this particular table in front of you. Now, what does this table tell you? You have a delimiter. The delimiter in this text, can you tell me? Is it a little bit clear? You see what is the delimiter between the text? You usually, when you're doing NGS files or you have OTU files that come into the picture, they are separated by commas or space or tab or some or the other delimiter. So it's really important that you separate this data out, put it in your Excel. I'm going to use comma as my delimiter because that is what is helping me separate my entire data set. I'm going to load it into the Excel sheet. Now again, this looks very haphazard. I don't like the format. The basics, when you see here, you can change the filter button, you can get rid of the band lengths, you can just filter out and remove all formats from your data. This is the way that you add in your data into an Excel sheet. This is the most easiest way to do. Now, if you have a faulty data set like this, the one that I showed you before, what are you going to do over here? You're going to use a little tip and trick, which is to find out what blanks you have or whether you have duplicates in your data. So I'm going to select the entire data sheet. I'm going to find and select and look for my blanks. So when I look for my blanks, I end up highlighting whatever blanks I have in the data sheet. This helps me visualize better where the blanks are. Now I can go in and just manually fill in because this is gender. So I know this is gender and fill in. And I have an example data set already, which I know is proper and correct. So if I'm missing data over here, I can always go back and look for the missing data. So I'm going to go look back and see, okay, this particular C5 data is missing. So I'm going to go here, copy it, paste it. This is the way I'm going to fill up my entire data sheet over here. After filling the entire data sheet, again, there are two important things. If you see the blood group status, some patients may have the blood group or not. So for this patient, suppose I have the blood group, which is A minus, and I add it over here. A minus is the blood group. But what if this patient does not have a blood group testing done? What do I do? Do I consider this control in my study or not? Is a question mark. I'm going to highlight this particular control and keep it so that later on, if I need to do any data analysis work, whether I want to consider this data or not is a question mark. Another thing is that you can see these inconsistencies over here. So what I'm going to do is a process called data validation, like I mentioned earlier, where I'm just going to select this entire row and go into data and select data validation. Now, what does data validation do? It gives us an option, a list. It helps me select that I only want this particular answer, yes or no, in my cell. I do not want any other spelling. I do not want any other spelling misconsistencies. I don't want a nope. I don't want a yeah. I don't want any other changes because while taking the patient, we just tend to write. I want to make sure that while I'm filling it continuously with my patient, that I do not have any other problem. So what I do here is, here, it changes of yes. Suppose I say I want to write no. It will immediately show me an error saying that you cannot add this. This is not allowed. You cannot add this to your data sheet. It will change back. If I just type N also, it will just change. It will give me the right format for my entire data set. Again, when you come to date or numbers like this, it's a very easy thing where you select the column that you want, you go into home, and you have a tab called as the number. Select what particular date format you want, and you go for it. So it's pretty much a manual process when you're doing data set analysis that you need to manually sit, give time to your data sheet and check the errors. There are a lot of Excel hacks that give you formulas where it helps you split your data into, suppose I want to separate the names from the surnames. That's a task again. So I'll be using a function over here, which is called, I want all of these in uppercase. I want them in uppercase. I want the names to be consistent. There is an inconsistency in the name. So I'm going to say proper. I'm going to select the name over here, center. So the name is in the right format. There is no inconsistency when it comes to names. Basically copy it here and paste it back over here. These are certain tips and tricks that you will use on your Excel sheet when you try to prepare a clean sheet like this, so that you can use it for analysis. Again, when it comes to SPSS, you cannot use spaces between the column names, so you use underscores everywhere. Now, this particular data sheet is ready for in. These are a couple of tips and tricks, and helps preparing your data. Anybody has any doubts or they need Excel codes?
Good afternoon. So I'll be talking about types of research studies. So before starting about the types, we need to understand what research is. So research is nothing but it is systematic, rigorous investigation of a situation or a problem in order to generate new knowledge or validate existing knowledge. Before going to the types, various types of studies, we need to understand what do you mean by variable. Can anyone want to attempt? She has shown multiple Excel sheets, all the columns, those were variables. And how we define variables? Variables is nothing but a measurable attribute. What is exposure? Sorry. What is exposure? Exposure can be anything such as risk factor or intervention or experiment that we are going to do. And outcome is what we want to measure in a particular study. It may be a rate of mortality, proportion of patient developing X thing, or a disease, something like that. There are There are two types of researches. One is applied research, where uh, is to study the a scientific study and research that seeks to solve practical problem which is in front of us, such as everyday's problems, such as curing the disease or developing innovative technology. And basic research, or which called fundamental pure research, is basically driven by scientist curiosity or interest about a scientific question. And the main motivation behind this is to expand our knowledge. So there are various types of studies out of them, which is grossly divided into whether it's a descriptive study or analytical studies. And analytical studies are divided into two, which is observational and experimental, uh, and they are subdivided subsequently. So what is difference between descriptive studies and analytical studies? A descriptive study is nothing but it's one study where that is designed to describe the distribution of one or more variables without any regards to any causal or any hypothesis testing. So in descriptive study, we don't test any hypothesis. So such as is there can be case reports, case series, or cross-sectional studies can be also a descriptive where the distribution, if we don't analyze further. So if you just collect the data, the distribution percentage of males, percentage of X, Y, Z, something like that. But if you generate hypothesis that in the cross-sectional areas such as CL lung is more common in elderly, then it becomes analytical studies. Basically, the descriptive studies are easy to conduct, inexpensive. There is no much ethical scrutiny, and it can be useful to detect burden of disease, and that can be helpful for planning resource allocation. What are analytical studies? These type of studies are more commonly done, which is analytical studies is attempt to test hypothesis and establish a causal relationship between variables. And in these studies, the researchers assess the effect of the exposure or intervention on an outcome. There are certain differences between observational and intervention or experimental studies. The observational studies are where those researchers document the naturally occurring relationship between exposure and outcome, the which is the research is being studied. And the researcher does not do any active intervention or experiment in any individual or exposure that has already or naturally occurring or some other factor. So the in observational studies, the researcher does not do any active intervention in any individual and the exposure that has already been decided naturally or by some other factor. In interventional studies are where experiments where researcher actively perform an intervention in some or all the members of the participants. And the most common of them is randomized control trials, where participant do not there is an equal chance to receive intervention or X intervention or Y intervention in these studies, compared to that non-randomized trials where there is no random allocation of intervention. If someone has developed new techniques, and that can be studied with interventional studies without any control. There are few studies such as which see pre and post intervention outcome, such as you are giving statins and you're seeing the difference between baseline cholesterol and cholesterol after 3 months or 6 months. These type of intervention studies are pre and post studies. Factorial studies, where suppose you have two different types of interventions and you are considering that combination may be better than the individual study, then you can do factorial studies, where you what will do, you will give a drug, you'll give either a drug or b drug or combination or none, and that type of studies are called factorial studies. There is another concept called crossover studies, where you want to see in a same set of patients where a single two intervention do separately or not. These type of studies particularly done in the inflammatory bowel disease. For crossover studies, there should be a time gap or washout period when you finish first intervention and you cross over to the second intervention. There is another type of randomized control trial which is called cluster randomized control trial. Suppose you are doing intervention in school group, and you are giving particular set of diet to that whole group, then that can be considered as a clustered randomized control trial rather than a regular randomized trial where individual is studied. Rather than when you are seeing the cluster, it can be as considered as cluster randomized trial. Studies can be defined depending on the directionality of study design. And based on direction, study can be either forward direction or backward direction. These are self-explanatory. Forward directional studies are where researchers start with determining the exposure to the risk factor and then assess whether the outcome occurs in the future time point. This design is known as cohort study. Opposite to that, a backward direction studies where researchers begin determining whether the outcome is present, that is cases versus non-cases or control, then traces the presence of prior exposure of risk factors, which is called case control studies. Similarly, a prospective or retrospective studies, where in the retrospective study the outcome of interest has already occurred or not occurred, that's in the control, and in each individual by time he or she is enrolled, and the data is collected either from the records or asking participant to recall exposure, and there is no follow up in this type of studies. Compared to that, prospective studies where the outcome has not occurred yet and study starts and the participants are followed over a period to determine the occurrence of outcome. And typically most of the cohort studies are in the prospective in nature, and case control studies are usually retrospective in nature. So this is the pyramid of level of evidence, where we start at very high level of information, but the quality of evidence is usually low. Then there is case series and reports, followed by case control studies, cohort studies, randomized control trial, and highest level of evidence stands with uh, systemic review and meta-analysis of randomized control trials. Which study design you if you continue to read, then you'll get ideas. So all the case reports, if you collect from your all other friends, you can convert that same case reports into case series. If the study is done in a retrospective fashion, you can convert that study into prospective fashion. If it is single center, you can do it in the multi center. If it is non randomized comparative study, you can plan randomized control trial that can increase the level of evidence. So and also if there is something new that is coming up, such as there are various landmark studies are being done in the chronic liver disease, but now there is a separate and dedicated entity such as ACLF, then you can replicate the studies which are done in the CLD into the ACLF, and then you can perform your studies. Thank you.
I have one question. So we have allergic bronchopulmonary aspergillosis. So steroids are the mainstay of treatment for allergic bronchopulmonary aspergillosis. Based on some case series, now I have started using voriconazole as the upfront for a lot of patients. A lot of patients have reservations about steroids, uncontrolled diabetes, and other things. And I'm finding that the benefit with voriconazole in this allergic bronchopulmonary aspergillosis is very good compared to the steroids. So suppose if you have to plan randomized control study, a little bit stringent things should be there. What kind of study would you suggest? Suppose I would like to show that voriconazole is better than the steroids in allergic
So
aspergillosis.
this both drugs are of different category, and if you want to plan the study, you can either start you take your previous study, your previous all the patients who was treated with steroids and the new patients who are treated with voriconazole and compare as a case control study.
Case control to start with case control and then if required later.
If you see if you're seeing difference, then you can plan randomized trial depending on that.
Case control is also type of non-randomized. Can you say
Case
that?
control is a comparative study where you see cases versus control. So for your active interventions will be like voriconazole and the control will be those who are on the steroids.
Okay. Thank you.
We can close the session. Thank you very much.